Hi folks, this is Dr. Rob CYWES, and there is a fairly new concept that is being debated back and forth in the ketogenic space, especially the more carnivore LMHR space, and that is the concept of insulin suppression, where your body is so fat adapted, your cells are so comfortable using fat that you really don't produce an adequate insulin response. And insulin is a very, very important hormone that regulates and governs a large part of the metabolic process and also regulates a large part of cellular function. So insulin is a very important hormone. We think of insulin primarily in response to glucose because of type 1 diabetes, but actually insulin has very little to do, and I'm going to say this, very little to do with glucose regulation. That's primarily a glucagon factor in healthy people. Insulin is more a regulatory hormone. Yes, insulin is required to get glucose into cells, but it's got so many other functions. And just as an aside, I was talking to Dr. Georgia Eid a little bit ago. That video will drop some time. But think about this. When I say estrogen and testosterone, what do you immediately think of? You immediately, most likely, think of women and men, and you think of estrogen and testosterone in terms of manliness and feminineness and sex hormones. But that is because insulins have been, at least estrogen, progesterone, and testosterone have been related to sex hormones. But the reality is, and this is kind of blows your mind a little bit, this is what George and I were talking about, is that the majority of cells in your body have estrogen receptors that have nothing to do with sexuality. Males and females both, and for example in the brain, every brain cell has estrogen receptors. Why? We don't know why. We don't know why yet. It's got nothing to do with sex. It's got nothing to do with masculinity or femininity. It's got nothing to do with muscles. Insulin, glucagon, human growth hormone, thyroid hormone, estrogen, progesterone, testosterone, they all are primary regulatory hormones of the entire metabolic system. And the human body has used them for certain purposes, additionally like clearing sugar or like making you male or helping you to be female. But those are byproducts of these hormones that are quarterback hormones in the human body. And along the same lines, this video is actually about insulin suppression. And folks like Ben Bickman, myself, recently I had a discussion with Anthony Chafee, we're just starting to understand the concept of insulin suppression, and probably, I'm going to toot my own horn here, not in an arrogant way, but I don't think there's any physician clinically active right now in the ketogenic space that does as much blood work on a variety of patients as I do. We are heavily centered on blood work. We've just completed a study with Dexcom where we looked at over 5,000 of our patients just looking at their blood work historically, and looking at trends and looking at changes over a course of 5 years. So we are heavily centered on analyzing and reading and understanding blood work. And that's how I got to see insulin suppression. Because I'm reviewing blood work on 20, 30 patients a day, every day. Yeah, it's burnt me out. But we start to see things that perhaps other people don't see. So when Ben and I went back and forth in an email just a little bit ago, the first part of what I'm going to read now is from Ben Bickman, who's seen this in his cells, and then I'm going to interpret and add my clinical impressions to this. So Ben has discovered the same concept in his cells, hasn't called it insulin suppression. That's a word that I've created, that's a phrase I personally created to separate insulin suppression, which is to lower an inadequate insulin response in a non-diabetic normal person, versus insulin sensitivity versus insulin resistance, which looks a lot like insulin suppression, but it's the other side of the bell curve. So what Ben says is that the insulin response to protein varies based on the glycemic status of the individual. Quite true. So if you're carnivore and you're not consuming any sugar at all, you have to have sugar, and your liver will prioritize the conversion of protein to sugar because the maintenance of your blood sugar, albeit at a low level, is crucial to human survival, particularly to the brain. If you're eating a ton of carbohydrate and you're a bump on a log and you're not physically active, then whatever protein you're eating, some of that will be converted to protein under the influence of insulin. But insulin resistance will reduce that. So you're not making adequate protein. Well, there's no store for protein. So the paradox is the body will turn that excess protein into sugar and raise your blood sugar. That's paradoxical hyperglycemia. So the insulin response to protein varies based on the glycemic status of an individual. That's from Ben, absolutely correct. If a person has low blood glucose with no glucose coming in through the diet, i.e. carnivore, the insulin response might be quite low, if at all. So you see very little insulin response. So on a Kraft table, that would be a pattern 5, equivalent to a type 1 diabetic. And you see a very low insulin response in response to protein, because protein doesn't trigger the hormones in the gut that release insulin. So the reason for that, and Ben is quite right about this, and it was a little aha moment for me, because if insulin rises, insulin will switch off gluconeogenesis, which is the process by which we convert protein to sugar, and then the human will be without sugar, and that is a terrible state. So you cannot have an insulin response to protein because it switches off gluconeogenesis, the production of sugar from protein. And that would drive the person, as Ben says quite accurately, into hypoglycemia, low blood sugar, because insulin normally inhibits gluconeogenesis. Now, in a insulin-resistant person, that relationship is broken. Insulin doesn't control glucagon. And also, insulin, when insulin is released, blocks the release of fat from the fat cells. It blocks lipolysis in the fat cells. So not only are you not producing, in a carnivore, not only are you not producing sugar from protein, you're also blocking fat. So the person is sitting without ketones or without sugar, and it's awful. They die or they lack energy. So that is why we do not release biologically insulin, or very, very little insulin in response to protein. And the problem then is, if you're eating excessive amounts of lean protein, the body has to store that. It's turning it into sugar. And once your stores are full or you're not using that sugar, it becomes triglycerides. It raises your blood sugar. Your A1C goes up. And we see that in the blood work that then very similarly represents and looks like insulin suppression, insulin resistance. So a lot of the blood work from insulin resistance looks like insulin suppression, except the insulin numbers are super low. C-peptide is super low. Whereas in insulin resistance, they're both high. So we can distinguish that, but you have to do blood work in humans to be able to know the difference. Just before we go ahead, one of the things that's always in my head is the protein sparing effect and how to promote adequate protein synthesis in the liver. Well, sometimes the human body uses protein to make sugar rather than to make proteins. And one of those is if you're at a glucose deficit, or if you're fat adapted at a ketone deficit, because some of those proteins, about 9 of them, actually when they get broken down by the liver, don't form sugar, they form ketones. So from time to time, if you've had a lean protein meal and you haven't eaten enough fat, popping something like this, ketone IQ, which is an exogenous ketone, will get you into ketosis very quickly, will restore your blood ketone levels, and then the protein that you've eaten will be used by your liver under the influence of insulin to make new protein, not to make sugar or to make ketones. Look at the show notes down below for a promo code to get 20% off. Okay, so if a person, this is Ben, however, if a person consumes protein with glucose, and protein together with sugar is very, very rare in nature. And Ben says this only happens with dairy in nature. So the only place we get protein with sugar naturally is dairy. And this is what Ben is saying, which only happens with dairy in nature, which is one reason why dairy, and I love him for saying this. He's a wonderful man, brilliant scientist, but even more brilliant for saying this. You know my bias. Which only happens with dairy in nature, which is one reason why dairy is such a perfect food for growth. So just like I do, Ben is an advocate for dairy during growth. And he goes on to say, So if a person consumes protein with glucose, which only happens with dairy in nature, which is one reason why dairy is such a perfect food for growth, or has hyperglycemia already, i.e. diabetes, type 2 diabetes, they will see a higher insulin response to protein. So only when you consume dairy, or if you consume, if you're already diabetic, or if you consume sugar with your protein, the Paul Saladino thing, watch my video on when is Paul Saladino right, that is when you see a spike in insulin, because it's okay because you got sugar as your fuel source. So historically, it was thought that the insulin and this is now me, historically in physiology teaching, when I was a medical student with Tim Noakes, it was thought that the insulin release response was triggered by hyperglycemia or a rise in blood sugar. So when your sugar was going up, you released insulin, irrespective of the source of that sugar. So for example, but while this does occur to a small extent, it appears to be a very minor and inadequate response to clear sugar from the bloodstream and doesn't adequately get rid of the hyperglycemia. For example, when people are given intravenous glucose, we put an IV in and they're given sugar through their IV, or people on TPN, total parenteral nutrition, their sugar goes up, but they're not producing an insulin response because naturally that is not a natural form of hyperglycemia. The body sees that as if that sugar is coming from protein because it hasn't come from the gut. And this is important to understand. So if the same load of sugar that is given intravenously or in total parenteral nutrition through the IV, if you take that same amount of sugar and you give it to the person by mouth, they get a much bigger insulin response. So the issue is not the amount of sugar. The issue is which direction, which route does the sugar take and what happens along the way. And what happens along the way when the sugar goes through the gut is that it triggers certain hormones, GLP-1 and the incretin hormones in the upper gut, that by themselves we know absolutely because they treat insulin resistance, then trigger the release of insulin and they block glucagon. They reduce glucagon, they reduce gluconeogenesis because you've got the sugar load coming in, and they release insulin. So the biggest insulin response in the body is triggered by the consumption of carbohydrates in the gut. And that's how milk works, and that's how any carbohydrate that we eat works. But it's GLP-1 that triggers insulin. If you eat protein, it doesn't trigger GLP-1, you don't get that protein rise. So if the same load of glucose is given by mouth rather than intravenously, the insulin response is much greater and adequate to reduce the subsequent rise in blood sugar. Except in insulin suppression, where you haven't had a carbohydrate response for such a long time that the GLP-1 system is not actively able to release insulin. That's insulin suppression. Or if you are insulin resistant, where you rise the insulin, but it can't clear the blood sugar because of a blockade at the cellular receptor level. So insulin suppression, even when you eat glucose, so if you take a person who's a lean mass hyperresponder, carnivore, is insulin suppressed, and you give them 75 grams of glucose to eat, which is a standard oral glucose tolerance test, their blood sugar goes screaming up and stays up for a long time. But if you measure the insulin, by definition, it's flat. It's below 30 units of insulin at peak, which we call a Kraft pattern 5, which is equivalent to type 1 diabetes, because the system is as broken in a different way as it is with your insulin resistant patients. So the dominant insulin response in the upper intestine is mediated by GLP-1, which is the likely trigger of insulin release, since these incretins are released by a rise in gut glucose. Therefore, this explains the effectiveness of the Ozempics and the Mounjaros when we're treating insulin resistance, because that's what they do. They increase your insulin, they clear the sugar, they get rid of insulin resistance. And this also makes evolutionary glucose sense, because historically the dominant source of sugar has always been the gut, not intravenous sources. So insulin also blocks fat release from the fat cells. It regulates cholesterol production, increasing cholesterol production, blocks ketone production, downregulates gut absorption of cholesterol, so that the lean mass hyperresponder patients have a high total cholesterol and a high LDL related to that low insulin. And we see that with the LMHRs. And Nick Norwitz, who's a brilliant young up-and-coming scientist doing his medical degree at Harvard right now. I think he's just finishing his first year of medical school, but he's got a Ph.D. in lipidology. Nick Norwitz published a beautiful paper talking about where eating Oreo cookies lowers your LDL rate. Well, why does it do that? Because it triggers insulin. The Oreo cookies triggers insulin. Not a good way to trigger insulin, carb addicts. Don't do this. It's better to drink some milk. But yes, the Oreo cookies lower LDL far better than statins do because they're triggering insulin. So yes, Nick, you're right, but here's the mechanism. And they trigger insulin that then lowers cholesterol production or cholesterol absorption, lowers LDL and lowers total cholesterol. And it's exactly the same as what we saw with a brilliant paper by a woman by the name of Isabella Cooper, featured just a little bit in our series on this YouTube channel, where the most fat-adapted ketogenic women in her study all consumed a moderate amount of carbohydrates on their ketogenic diet to trigger GLP-1, to trigger insulin. That's how you stay insulin sensitive and don't become insulin resistant, even while you are in ketosis. My son, my 3-year-old son, who's a 95+% carnivore, gets a bottle of milk, just like Ben and I have said, bottle of milk with heavy cream, fat, protein, and carbohydrates, glucose and galactose, not as a source of energy, but to trigger insulin. Because if he's pure carnivore, he's not releasing insulin, which is a growth hormone. That's why he drinks milk. And that's why I'm a huge advocate for milk if you can tolerate it. But here are some questions that are unanswered for me, because we're just learning about this. First question I have is, does this mean that humans are best on an omnicarnivore diet, or is a carnivore diet optimal as long as they consume milk or some form of glucose? And I believe that's true. I think carnivore is probably the healthiest diet, but you need some trigger for insulin, and that is milk. But if you want to add some honey, if you want to do a bit of Paul Saladino, don't be as crazy as he is with the amount of carbohydrates he's eating. That I think is over the top, but a little bit, anywhere from 50 to 75, topping out of maybe 100 grams, depending on how much total calories you're eating. That's absolutely fine. I hate that calorie narrative. But for example, even the Maasai, these carnivores, well, they take milk from their cows and they mix it with blood. They are milk dominant as a tribal group of humans, even though they're carnivore. They use milk. The second question is, and I don't know the answer, but I need to Google and look this up. What is the insulin biology? How does insulin respond in animals that are pure carnivores? See, humans are thought of omnicarnivores, and I use omni small letter, carnivore big letter. But if you look at the pure carnivores, such as the cats, from a little cat to a lion to a tiger to a cheetah, all the cats are pure carnivores. So are the reptiles. Reptiles are pure carnivores. What happens to their insulin response? I don't know. I need to Google this. I don't know if it's known. But is theirs different from ours, or is it the same as ours? They don't drink milk. Well, the babies do, but the adults don't. And they're eating pure meat, and they're eating organs, and they're eating fat. But I don't know what triggers their insulin. Is it also GLP-1, or do they have a different response to protein and fat? I don't know. I need to figure that one out. And the third question is this. We know from my blood work on my patients that A1C goes up, that triglycerides go up, that blood urea nitrogen goes up, that blood glucose goes up. Even though you're pure carnivore, even if you're high-fat carnivore, we know that happens in insulin suppression. That's what defines it. But the question is that harmful? And I don't know. Time will tell. I certainly am concerned with it. So I do advocate for a glucose trigger. But I don't know. I don't know. And Anthony Chafee and I talked about this a little bit ago, because he's about as fastidiously carnivore as a human being can be. I don't know. I don't know the answer. Intellectually, it concerns me that these numbers are rising. And not so much that the numbers are rising, but that insulin is lacking and insulin has other functions. But I don't know. I don't know. And I'll share something else with you that's just popped into my head now. I didn't even talk to Georgia about this. I said at the beginning of this conversation that estrogen is not just a sex hormone. Yes, it has a role to play in both male and female sexuality. But estrogen receptors occur on every cell, including the brain cell. So here's a question for you. Men continue to produce estrogen lifelong at low levels, no question about that. But women often stop producing significant amounts of estrogen after menopause. And there's all this debate back and forth about hormone replacement. Should I, shouldn't I? Should I be on estrogen, progesterone, blah, blah, blah. And it's always thought in the context of femininity and of fatigue and hormone cycling and hot flashes. It's always got a sexual basis for the prescription of progesterone and estrogen. Just a question, I don't have the answer, but I'm going to ask. Should every postmenopausal woman not be on low-dose estrogen because of the other functions of estrogen? And even before that, what are the non-sexual functions of insulin in the human body? Not insulin, I keep using the word insulin. What are the non-sexual functions of estrogen, of progesterone, and of testosterone in the human body? Testosterone we know pretty well. What about estrogen? Why are there estrogen receptors on the brain? And what happens to a woman's brain after menopause when they aren't triggered? And should they be triggered? I don't know. But that's what I love about what I do. So many questions, so much intellectualization. But don't be afraid of sources of carbohydrate to trigger insulin. Be very careful. Don't go be doing Oreo cookies, because when I have one Oreo cookie, I'm eating the whole rack and I'm stealing yours. I can't control myself. Nick may be able to do that, Nick Norwitz, because he's never been fat. And his video made all the right points. Don't go and eat carbohydrates to trigger your addiction. But be sure that you get some form of non-addictive carbohydrates in your diet. And you and I can discuss that if you set up a consult. 561-517-0642. WhatsApp us, call us, leave a message, voicemail, text us. We'll get back with you and we'll set up that visit. And if you like what we're talking about, if you're intrigued, ask around. And I'm not right or wrong. I'm asking questions based on my observations in the science of the clinical practice of my patients, as is Ben Bickman. We are seeing things that we can't completely put together, although when we talk to each other and with each other, we start to get consensus and we start to understand it. And Ben's insights were brilliant. And he and I need to talk more on this channel. I am the Carb Addiction Doc. If you like the content, leave us $1 or $2. You'll see in the show notes, you'll see my Patreon account, you'll see my PayPal account. Throw us $1 or $2 if you don't mind. Till next time.